Welcome to the Ask the Expert segment of Your Health Matters. Today our guest is Dr. Jeffrey Jones, Medical Director of Cardiology at Meritus Medical Center. Our topic today is radial heart procedures. Welcome, Dr. Jones.
Thank you for having me.
Now, how is the way Meritus Medical Center performs cardiac catheterizations different from other hospitals?
Well, the cardiac catheterization is a procedure where the catheter is placed through an artery, usually in the groin, in the leg. It passes up the major vessels of the body, and it goes to the heart, where the heart arteries can be injected and imaged with a radiology camera. Many of the procedures, in fact, most of the procedures at Meritus Medical Center, instead of going through the femoral artery in the leg, which is about as big around as my thumb, goes through the radial artery in the wrist. And there are several advantages from going through the radial artery. The vessel is much more easily identified and entered. There are much less problems with infection, injury, and bleeding when you use the radial artery. So the patient does not have to stay supine after the procedure. When it's a femoral artery approach with a sandbag for maybe 4 to 6 hours, the patient can immediately after the procedure stand up, get a bandage on the radial artery, and eat and go home in probably about 2 to 4 hours.
What complications could there be with a procedure like this?
Well, cardiac catheterization is a procedure that is used in people that are usually pretty ill. They have coronary disease. Oftentimes they're having a heart attack, an acute heart attack. So they're on blood thinners to help open the artery to begin with. So if you're performing the procedure in a vessel where it's difficult to control the bleeding, like the femoral artery, there's more issues with bleeding versus the radial artery, where the procedure can be much more better controlled and the bleeding can be better controlled than if it was through the femoral artery. That's the big advantage with the radial approach.
All right, now you said that a lot of other hospitals nationwide are not using this approach. So what made Meritus decide to go with it?
Well, there's about 8% of hospitals nationwide are using the radial artery approach. And it was predominantly the selection of the interventionalist. The interventionalist that was hired to come to Meritus and join us on the cardiology team at Meritus. That was his area of expertise. So I think as a consumer, and when you are looking for a cardiologist and you may need a cardiac catheterization, it's important to ask if the availability for a radial procedure exists, because that is going to decrease the risk of complications and improve the overall outcome from the cardiac catheterization.
So is this something you see more and more cardiologists turning to in the future? Absolutely, yeah.
Actually, I went to a training course about probably 15 years ago now, when radial catheterization was first becoming the rage, when it was first becoming popular. And what's really brought it into much more popularity is that the catheters have gotten smaller. As the technology improves and the catheters become smaller, obviously you can go into smaller and smaller vessels. So as the catheters become small and it's easier to enter smaller vessels, this procedure is much more easily performed than it was 15, 20 years ago.
Great. Well, it sounds like you guys are really leading the way.
Yeah, absolutely. And like I said, someone comes in with a heart attack, they go up to the cath lab, the catheter is put in their wrist, it goes to the artery where the blockage exists, the artery is opened up, and before they know it, the pain's gone, they got a bandage on their wrist, they're eating, and they're feeling much better.
Well, thank you for sharing your time with us.
Thank you. Thank you for having me today.
You're watching Your Health Matters, brought to you by Meritus Health. We'll see you again after the break.